So we're now going to move on to a panel discussion, and welcome back Georgia and Matt, and welcome for the first time Kelly. So I'm just going to introduce Kelly first of all. Kelly is with Living Streets, the UK charity for everyday walking. She runs the Workplaces programme supporting organisations to become more walking friendly through a range of tailored offers. She's passionate about sharing the benefits of walking and active travel, moving her family to a one-car household during the pandemic, and not looking back since. And in terms of a secret that her colleagues might not be aware of, if a place is too far away to walk, she'll cycle, taking people's accolades on her fitness levels when she arrives, despite the fact she's actually riding an e-bike. So thanks for that honesty, Kelly. Before we get into the discussion, as you can see on the screen now, we are giving away 100 of Mike Berners-Lee's books, There's No Planet B, for those people that engage with the best questions and interactions. And so just go to the tab on the right-hand side, the stage panel tab on the right-hand side of your screen, and get involved, please. Fantastic presentations by everybody. I guess I'd quite like to start just picking up, Guy, if we can, on what you just covered, which I found absolutely fascinating, everything around habits and attitude and so on. If you're looking from an employer's perspective, an employer who has struggled to make change happen with their employees, what advice would you give them in terms of how they could be more impactful, particularly around what the major topic today, which is sustainable commuting?
Well, I think I would follow on from that the comments about habits, and I think if there's one thing that behavioural science tells us is that context is everything, and so we can quite easily look. We can talk to employees about what they'd like to do, what they think is important, etc. But unless we sit down and actually look at the specific environment around which we want to see that behaviour happen, chances are we may well miss opportunities, quite simple opportunities, to make that behaviour a reality. I mean, we are very good at changing as a species, but we don't particularly like it. It's very effortful, and we do see effort as a cost, so we try and avoid it. But I think that would be my main point on that one, is to say, well, actually, let's look at those specific moments in that process where you want to see that behaviour change. If we were treating this as a behaviour change project, you would drill down to say, right, well, what needs to happen at that point, at that point, at that point, etc. I think unless we do that, we could well uncover these very positive attitudes. But there is, as I mentioned in that talk just now, there is a significant risk, as often as not, that those attitudes simply won't be salient at the moment you're trying to engage in that particular behaviour, that other impulses, other forms of motivation will take over. And it's not to say the person is not being true to their attitudes, it's just that those attitudes aren't relevant at that moment. They're not instrumental in driving that behaviour. So I think diagnosing specific moments in that process is the way to find ways, I say quite often very simple ways, to make sure that those attitudes are salient and you see the change in behaviour.
Okay, thank you. And just to bring Kelly into the conversation, in terms of the work that you've done, Kelly, what do you believe has been the most successful method that you've used in convincing people to walk to work?
I think the big thing really is, everyone's talked about it, is the kind of culture shift, and particularly, we all know the benefits of walking if we sit down and really think about it, but we don't really do that. And I think where we've seen the biggest impact is where, people convincing other people to walk to work. If you've got someone within your organisation, people within the organisation who are reminding other people about the benefits of walking, they're walking themselves, they're encouraging others to come out with them, and generally kind of being a supportive walking buddy, it convinces other people to do it. We call those people at Living Streets, they're our walk champions, but really, it is those advocates within an organisation who support that, really.
And Georgia, I'm guessing, because you are also focused obviously predominantly on active travel and cycling, do you echo those thoughts? And what are the major blockers that you've found so far to getting people engaged?
Yeah, no, I very much echo those thoughts, and just kind of building on what's been shared. I do think you have to engage with people, you have to engage with their values, and I think that goes deeper than asking kind of, do you prefer a car or a bike or to walk, but actually asking about, what is driving your choices. Is it because you want to get home and be with your kids longer in the evenings? Is it that you prefer to have slower journeys into the office? And I see that I'm really eager to kind of answer the next question, because I think it's really hitting this point. But I think, it was mentioned that it's not just about that engagement with people. And that's where we are coming on to the other values of really thinking about the place. Are you enabling people to make choices? Are you enabling choices to happen? I had an example of, I've been in working in bike sharing companies for many years, but it was in this workplace that was the first time I cycled in and used facilities in my office, in my workspace. And that's not because so not the first time I've cycled in, but first time I've cycled and used the facilities in my workspace. Not because the other workspaces didn't have facilities, but the placement of them and how close they were to the office space and how invaded my privacy felt. I just didn't feel comfortable to use them. So there is this responsibility of thinking about the full end-to-end journey. Are you creating places and spaces where these journeys are being enabled, and tying that in as well? And then coming on to the planet, I think we can hark back to there's no planet B, but in terms of your emissions and your footprint and your responsibility, if you look at scope 2 and 3, 1, 2 through 3, there's a lot more to it than is just simply about moving your employees' behavior. So if you want to engage them with that side, you have to engage them with the whole lot and not falsely kind of explain it in a way as if their footprint and their individual choice of that journey is the total sum of what needs to happen. But it does need to be explained in a way that it is an important and critical part, and it's being viewed that way from the top down as well.
Thank you. And Matt, do you think from an NHS perspective, a healthcare perspective, that's happening enough across the NHS?
No, in a nutshell. There is, so roughly between 80 and 90% of all chronic diseases in this country could be avoided through how we live our lives, what we eat and how we travel, and how much physical activity we get, and some other things as well. But they are preventable. Imagine not needing to spend as much on health services because we didn't have the illnesses in the first place. And so when I talk to practices, it's what's the benefit to the patients, what's the benefit to the practice, what's the benefit to the population that they look after of, in this case, active travel. And actually all of them benefit, but they don't necessarily realise either the negative impacts that they're having through their current choices or current travel patterns, and the benefits that they will get and their workplace will get and the society or community that they live in will get. So no, I don't think it is highlighted. And one of the dangers has been that the health service has gone down the machines that go ping and sexy tech stuff. Walking's a bit boring, really, in comparison with the machine that goes ping. But it's actually far, far, far more effective and far, far more cost effective. So no, I don't think that not only the health service, but society, I don't think is necessarily aware of all of the personal and population and planetary benefits that could be achieved.
Thank you. I'm going to go to questions from the floor now. From Emma Brown, how can organisations make sure that the push for sustainable travel does not feel invasive or disingenuous, if I can get my teeth in, to employees? Georgia, I think you said you were quite desperate to answer that one first. So
it was, to be fair, it's actually the second question I was really excited to respond to. But on this one, I think we've spoken a little bit about it here already, in that, you have to involve them and not be disingenuous, essentially. You have to be clear on why you're taking on that piece of work, communicate that and involve your teams in that process, and be willing to be wrong, be willing to have other people challenge and come up with ideas and push for different types of changes that maybe you haven't considered. I think you don't come across as disingenuous with it not being a disingenuous approach. But I think there'll be a lot more to share across the panel on this as well.
Yeah, any other thoughts? Do jump in, Matt, Kelly.
Who's going to go first?
I'm going to let you go first because you're alphabetically closer.
Yes, I think there's something called a reactance effect, which is when we don't like being told something's a fait accompli, or we don't like an argument that's fully assembled being put in front of us. So I think there is that's one way to sort of dismantle that issue. That actually, if the organisation can put forward the components of an argument, the components of the rationale why they're asking people to do this, that will go a long way to help that. It is true though that in lots of sort of behaviour change studies, the minute you sort of tiptoe into what's deemed to be a more sort of ethical or responsible behaviour, it is a bit of a live rail, and people do push back again quite a bit. So I do recognise that's a concern, but there'll be lots of things an organisation could ask its employees to do, for example, around compliance, for example, and that will never be considered disingenuous. But the minute it starts talking about sustainable behaviour, for better or for worse, it does provoke a stronger reaction a lot of the time. So that need to not lose or alienate the teams is very important.
Georgia?
I just want to jump back in because I think you've hit the nail on the head in that comparison of organisation can ask an employee on a compliance side of things. And I think that comes down to having a clear and communicated framework that this is something that's important. I think you would also struggle with asking an employee to do something on compliance if you hadn't introduced that topic or need or value into the organisation at all until that moment. So you have to build the framework that this is a part of, and that is really looking at the full picture of your responsibility on carbon, and where this features as a part of that framework and as a part of that strategy, and being able to therefore come at it from a place that is as strong and as grounded as a compliance approach to compliance.
And Matt, you wanted to join?
Yeah, I was going to say that for me, it's been very much asking the working in health. It's actually quite easy because we don't want to cause harm in the first place. I mean, that's opposed to what we actually want to do. So actually, I've worked with a number of practices where you actually give them the problem and you say, as an organisation, we don't want to cause harm. We think that we're causing harm through the way that we are delivering services, healthcare at the moment. How could we avoid that? What options could we do as a practice? So it's not saying, what are you going to do to start with? It's saying, what can we do as a collective? It's getting sort of team buy-in that, we all agree that actually if we reduced how we travelled or changed how we travel from sort of a polluting version to a less polluting version, and then it's the question of, well, what do you see your role within that? And actually because they've already given the answer, whether it was semi-directed towards that answer or whether they came up with it sort of on their own, they then sort of own the answer of, well, we need to be more active, and these are the ways in which we can do it. So actually, for me, it's putting it exactly as Georgia said. The value of the organisation comes first. Give the staff the problem and say, how would they solve it? And they do. It's magical sometimes.
And Kelly, do we celebrate success sufficiently when we're actually putting these things into play and we're seeing change and we're seeing impact?
There's a mix, isn't there? I think my immediate answer would be no. I don't think we celebrate the successes enough. I think it would be great to see that done more, and particularly, for people who choose to travel sustainably and choose to travel in a different way than jumping in the car. I think one of the things that we talk about is that sort of reward for using a different mode of transport. So perhaps a hot drink when you get into the office, you know, something like that can really help to sort of celebrate those achievements, and things like, you know, if people are walking more, what can we do? How do we support them when they get into the office? And yeah, celebrate those achievements, you know, photo walls, those sorts of things that we do for, like, you know, local walks and things. I think that can work really well.
Thank you. Okay, I'm going to move on to another question. So, Chris, no, where were we? That question's gone. Okay, I'm going to go to Chris's question on, no one seems to talk about mobility for disabled people. Any ideas? Who wants to go first? Georgia?
I absolutely. Although I will say there are some amazing and lots of incredible people that are talking and really doing the work in pushing for a greater focus on enabling people with disabilities to move around as freely and joyfully as anybody else. And I'll mention a few of those names and some stuff that can be looked into and kind of guidance that is out there. But you're absolutely right. The population, it's 20 to 25% of the population estimated, but it's going to be far greater than that, identifies having a disability or have a disability, living with a disability. And there is an estimated 40% transport gap. So that's 40% less access to jobs, education, community, so that we're already seeing negative effects just in that. But when you then also factor in, do you have the option and the choices for more sustainable forms, again, I think that gap is going to just widen a lot further. And so I think there is a lack of data on that second stage, but there's a lot of data out there. We know what the barriers are. We know what's not happening. And so I think now, and you know, where I'm really agreeing with you on, we need people to really talk about this and start focusing on it as not a nice to have, but as this is a bare minimum that we should be delivering to everybody, is closing that 40% as quickly as we possibly can, because it's ridiculous that any group would have that level of access. I mean, you know, you're not accessing your GP surgery as easily. You're not accessing your carers, or they're not you know, it's really a massive issue. And there are some incredible people doing work on this. I would encourage you to look into Wheels for Wellbeing and the work that they're doing, Wheels for All, incredible advocacy groups, but also really they are able to deliver, also Transport for All, they're able to deliver really useful workshops and in consulting for your organizations on understanding these barriers and really recognizing the ones that are easy for you to help remove as well. And then there are, at a larger kind of scale, there is the formation of NCAT, the National Centre for Accessible Transport, and you know, a lot of research, huge amount of funding coming through there. And then of course the largest kind of funding pot holder, who is kind of most influential in this space, has been the Motability Foundation. They tend to have moved towards cars because they are sometimes the best form of transport and the most sustainable way for somebody to move at the time. It depends on what your needs are, but they are more and more moving towards looking at how do we enable people towards more sustainable journeys, and are very much involved in NCAT and the work that's happening there as well. So there are a lot of people who are talking about this, who are doing the work. I think what we need to change, and again, this is like moving towards the benefits, moving towards higher standards of what we're trying to achieve for people, is to stop talking about what are the barriers. We don't know what the barriers are. We know what the barriers are. We've been told what the barriers are. Now the conversation needs to move forward to getting rid of them, removing those barriers, increasing benefits, and it needs to move towards everybody having the same standard of enjoyment and ease in their ways of travel, not just the bare minimum of being safe and having an option.
Yeah, and a big part of this, of course, is access, and a big part of the role that we play in the work that we do is improving access to work, to services. And linked to that is the next question, which is around people that live more rurally, that don't have access to public transport. They're too far away to walk and cycle. Matt, your thoughts in terms of access to GP surgeries, and Guy as well in terms of healthcare. I mean, what are your thoughts on the rural community and how we help those people to access services in a more sustainable way?
Absolutely, and I think that this is a big issue. One of the problems is where health facilities of whatever description are situated, and actually they should be far better placed than they are at the moment. They're not as bad as some other services, but they're not great for some communities. Personally, I think that there will be people who do live out in the back of beyond, who do live in some of the smaller villages, who will use cars to travel. We saw from Professor Bernard Lee's work that the impact on health is less in a rural environment than it is in an urban environment. Personally, I accept that we're not going to get everybody in active travel. There are things that we can do on each journey that makes it less time in the car, more time out of the car. But there are going to be some communities who I think are going to struggle to be as active as those who are in more built up, more urban areas. So I don't think that there's going to be one answer for everybody. And this is, for me, the importance. It's what can each of us do for ourselves, and how does it fit into our lifestyles? And it's not going to be the same for each of us.
Thank you. Guy, anything to add to Matt and Georgia?
Only to, I suppose, to reiterate what they've said. I think if you look at some of the most popular sort of models used to predict behaviours, that question before is really pointing to that fundamental physical opportunity barrier. And unfortunately, the only answer to that is infrastructure. You can have the greatest will in the world. You can, what we'd say, have really, really high psychological capability, so all the benefits. You can have extremely high reflective motivation, but you simply can't do it unless there is unless the infrastructure is in place. So I think it's a very obvious answer there, and it's reiterating what the others have said, that in that respect, it doesn't rest with the individual. I think something else will need to change for them.
Yeah. Okay, thank you. Next question from Chris Webb, who I've seen has asked a few questions, so thanks, Chris. And Kelly, you obviously work with a lot of employers. This question is asking if only a part of a very large organisation thinks net zero is a priority, the rest have other priorities. How do you help address that?
Yeah, well, I think we touched on this a bit earlier as well, is that you've got to communicate with the rest of the organisation. You've really got to understand what their priorities are and how that can then fit into kind of net zero or whatever we want to badge it as. I think there are so many benefits to we focus on walking at living streets, but there's so many benefits to walking that aren't just about net zero. Clearly that's a big priority for us, but it's there's physical health, mental health, general well-being, productivity. Productivity increases through activity, and I think there are lots of things about active travel as a whole that will fit into other priorities within the business. There isn't going to be anybody within a business who doesn't think that reducing absence amongst the workforce is actually a good thing. So those priorities, those business priorities, we recognize are extremely important, but also they will be achieved through more walking, less car usage. So I think that would be how you would encourage others within the organization to align with you.
Any other thoughts from others? No? Okay, that's fine. We'll move on. Chris Trolley, thank you for your question. Most consider commuting as a process of getting from A to B. How does the play element come into this, and how can it be used to encourage sustainable travel? And I don't know where I could possibly start here, but Georgia, What are your
So
thoughts?
excited. No, I think it's a really good question, because play is can be quite nebulous if you aren't specific on what's meant and what context we're using it. But I think in the context of the commute, I would first definitely challenge the idea that most people are just concerned about getting from A to B. And I think this idea and this concept that that's how everyone travels is most commonly challenged through the gendered lens. For a woman's travel planning and behaviours, I can say as one, but also having seen the data and the evidence and the books and the research out there about it, it becomes also about safety. It becomes about function. Trip chaining is a lot more common for women. It might be about, I need to go and see my elderly parents on the way home. So these responsibilities and needs and values actually factor in a much bigger way for most people's journeys than just getting from A to B. And so that A to B journey planning viewpoint has been part of what's caused us to kind of build entire transport systems around the idea that that is the standard way of transport, and actually essentially boils down to the most commonly held commuting behaviour for a middle class white male. It doesn't necessarily translate to the commuting behaviour of the majority of the population, who are not necessarily just going in and out of the office, and that's what their kind of movement around is about. And so, yeah, I think just first challenging that's just not the reality of how people move. I think it's also really then important not to just take that binary view if this is about gender or it's about one element of your identity. Intersectionality plays a role. So speaking for myself, again, sometimes my gender will determine my travel behavior. I worked really late one of the nights this week, really late. Despite having my bike here, I chose to take a rideshare because it was more important to me at that time to feel safe. But a couple of weeks ago, I was going to an awesome event in Birmingham, and I need to get to the train station. And the needs that I had were, due to my neurodiversity, were more important. They even overcame my absolute horror of being awake in the early hours of the morning. I was up, and I preferred to get up an hour earlier and at 5 a.m. to get to the train station by bus, because for me, that was going to give me the most personal space in an early morning travel. It was going to be the least amount of walking, because that's what I knew I would need. I just wanted to sit there and I wanted to be drawing my garden plans on my iPad. I didn't want to be changing from train to tube to walk to get to the train. So my choice wasn't about speed either. It wasn't about time saving. These are things that we commonly build our transport systems around, but it was about what is the preferable, most convenient way that fits in with my needs and my values for what I need to get from where I am to the train station. And it took about twice as long as the fastest journey. And I have to shout out Citymapper for having so many options of ways to configure your journeys, because I think they're onto something there, that it's not just about what's the fastest way from A to B, what's the most convenient way. And yeah, so just finally on that, I think, yeah, saying convenience of travel isn't always about time. But also that's where we come back to that thought about play, because it can be from the perspective of having time for it, and actually how people travel, what they do on their commute. It doesn't need to be, oh, you have to make this journey the most fun of my day, but you can also do some work to make it the least terrible of your day, by giving people more time to make the choice to go by bus instead of by 3 different tubes. Or you can also consider are they able to move in a way that is allowing them to live and to practice their values and to spend time with their elderly parents and have a game of chess. These are the elements of how play plays a role. So it's valuing play as an important benefit rather than using it as a tool.
Thanks, Georgia. And Matt, you put your hand up.
Yeah, I was just going to recount a tale of, we had a lot of snow one year up in the north where I live, and the practice I was working in got snowed in, or inaccessible. And so suddenly the staff had to start walking to work instead of driving to work. So it was a disruption. And suddenly they were dropping their kids at school in the car usually, but then it snowed, they started taking them on a sledge. And they realised that it was quicker for them to walk their kids to school on the sledge and then walk to work than it was for their normal daily commute. But they would never have done it had they not had the disruption. And the amount of joy that came on their faces from spending time pulling their kids on a sledge to school for a month was overwhelming. I mean, it was absolutely beautiful to see. And yet we tried to change behaviour before that, hadn't been possible, but it was the disruption. And so suddenly they had seen nature, they had walked past, cobwebs with frost on it, hedges that were covered in snow that had snowball fights, and they came in ruddy-faced as sort of, as middle-aged staff, having had equally as good a time as their kids. And for me, that play, it felt like quality time with their family rather than sort of, sat in bumper to bumper traffic for, 20 minutes. And that was just a joy. And then people started saying, oh, well, when the snow goes, maybe we could start cycling, or we could just walk our kids more often to school and then to work. It was beautiful and glorious. And it was those sorts of times that I think can just emphasize that the commute can be fun, can be a joy, can be something that they looked forward to, as opposed to something that they just sort of dreaded each day.
Yeah, totally agree. And car sharing is one of the options that are available is part of that as well. It's actually sharing time with other people rather than gripping the steering wheel with all your might and frustration as you're sat in a jam. Okay, I'm going to move on to a bigger picture one here from Emily Stone. Thank you, Emily, for your question. How can we map out the links between environmental benefits and health benefits in a clear and accessible way so that they can be more widely understood? And this is something that keeps coming up, and not just today, but I've seen this in a number of conferences recently about this link between climate emergency, climate crisis, and the health emergency in terms of air quality and pollution and so on. Who would like to pick up on that one first? I don't think we've... Matt? Yeah, go for it.
Well, it's a health question. I mean, I can't not. So there's a whole host of... it depends on what works best for the audience. So for some, it's the infographics. It's that poster that they can put up in the workplace that says, if you do A, then this happens. If you do B, then that happens. If you want technical stuff and stats, there's that sort of stuff. If you want videos of people commuting on a bike and measuring the air quality as they go in different parts of their journey, there's visual bits of data and information available. For me, it's what's going to lead to the most change in behaviour in positive travel terms. There's a lot of information out there. There's a lot of health professionals. By all means, contact me. I've got goodness knows how many documents if you wanted to look at them. Ellie Kissy Deborah was the 9-year-old who died in London. Her mum has been a huge advocate of changing behaviour because of air pollution. There's a lot of Department of Health and NHS England information. I did some work with Birmingham Children's Hospital A&E department. They realised, or we told them that they were in the 98th worst air quality in the country, and suddenly the penny dropped as to why they were getting so many kids in with respiratory problems, and maybe we need to solve the problem a bit further upstream. And it was the inequalities and the where people lived, and so there's a huge amount of information out there. It's easily accessible and it's available in a lot of different forms. We know the problem. It's the doing, it's the action, it's the changing behaviour that's the trickier bit.
And Kelly, do you bring this into play? I assume you do in a lot of the work that you do, and encouraging people to walk and connecting that from a health perspective as well as the climate perspective, and joining the two together.
Yeah, and it's really important to join those two things together, and also to really understand people's motivation. What is it that, well, we've talked a bit about barriers, but what is it that makes people walk more, and what helps them to keep walking more? And I think, for some people that will be environmental. That will be some, you know, they want to do it for environmental reasons. For some people, it will be health reasons. And I think if you can understand which side of the fence, so to speak, people are on, you can then bring in the other information to support those choices that they're making or not currently making. I think that really helps to understand, because I do think there are people who are doing it for just purely for their own personal health. You know, they're prepared to walk more for their own personal health, or you can motivate them through that. But let's build it into a bigger picture. And I think Georgia talked about apps that exist that are, you know, that are great for that. And I think any sort of technology that helps to people to understand, you know, they're cutting down their emissions by walking by this much. I think that really helps as well.